My name's Tom Chapman. I'm Executive Director of the American Orthodontic Society, and it's an honor to be on Dr. Bill Wyatt's channel today and to talk about an organization that has impacted dentistry. The American Orthodontic Society was started in 1975. Dr. Wyatt was one of the early members, if not one of the founding fathers of this organization. It was committed to teaching general and pediatric dentists how to incorporate orthodontics into their practice. Today, 43 years later, that is still the mission of this organization. And why is it important? Because there are orthodontists who are specialists, and we're not specialists in orthodontics. But why is it important that we're here? It's important because the specialist in the United States cannot possibly see every patient that needs orthodontic treatment, any more than the pediatric dentist can treat every child in America. The orthodontist cannot treat every orthodontic case. So we provide that general dentist and that pediatric dentist, which is the first line of dentistry to most of the population. We present them with an option to keep from having to refer patients with cases that they can do. Our programs that we teach run the gamut from basic comprehensive programs with a dentist knowing only what they learned in dental school, which is often not very much about orthodontics, all the way to the most advanced programs that a dentist may want to go to. That depends on their interest, that depends on their skill level, but we provide a spectrum. As a nonprofit association, educationally based, we also provide a credentialing process within the organization where a dentist can go from a comprehensive course all the way to what we call our diplomate of the society. It's a recognition of great accomplishment when you reach that level. And 5 to 10% of our members strive for that level and reach it. So educationally, we believe that our courses, which are all recognized by the American Dental Association and the Academy of General Dentistry and each state in the United States, we believe those courses provide the most outstanding training that any general dentist can get in orthodontics. And there's so many people that just simply can't get to an orthodontist. Many of our members are in rural towns in Minnesota, small towns in Iowa, and all over the United States. And they provide the patients the opportunity to affordably and conveniently have that orthodontic treatment that they need. And these are general dentists that are doing other things. They're doing the whole spectrum. They're doing implants, they're doing the fillings, they're doing the hygiene, they're doing endo, they're doing some perio, maybe in some instances some surgery. Well, they go ahead and incorporate orthodontics into their programming. Many of our doctors, their practice is ortho is 15% of their practice. But it can go all the way up to 100%. Some of our members are so well trained and they practice for so many years that orthodontics becomes the sole part of their practice. But it's very comforting when a patient goes in, builds a relationship with a dentist, and then that dentist says, I can take care of that problem. There's this great comfort that comes from doing that, and we try to provide that. Patient loyalty is a big part of what we offer. We also want dentists to know that we will be there for them, and our organization provides a great mentoring program. When you graduate from one of our programs, you not only know how to do orthodontics, you're given a mentor. You're giving an individual somewhere, hopefully in your neighborhood and environment, but if not, with today's internet capability, cases can be transferred and advice can be given over the internet and over the telephone. So we have mentors, and that's very, very important. For the young dentist, someone in a residency, or someone that's within a year out of dental school, we know the kinds of debts that the students take on. We know the sacrifices they make, and we want that young dentist to be exposed to orthodontics very quickly. So we offer excellent discounts. Excellent discounts. So that's who we represent. That's what we are. We serve the public. We serve practices. We serve the whole dental community. And we will continue to be doing that for years. If you want to know more information about the American Orthodontic Society, we have a website, www.orthodontics.com. That link is below and will take you to our entire course catalog. It will talk about our instructors. It will talk about our credentialing process. And we have our digital copy of our journal. We put a quarterly journal out. If you're a member, you get a hard copy journal and you get access to a digital journal online. We also, from our website, we have a podcast called Orthodontic Smiles, hosted by Dr. Ed Gonzalez. That also can be reached from our website. And today, with today's Bluetooth capability, you can sync up your phone in your car, go to our website, punch on Orthodontic Smiles, and as you go down the road, 25 minutes, you can hear some very, very interesting discussions on orthodontics today. We are a contemporary organization. Our doctors don't have to go through years of departments screening the curriculum. If they're trying something and it works, they teach it in the class. We were one of the first organizations to teach early treatment interceptive orthodontics. Dr. Wyatt may have been the first to do that. So I encourage you to look at our courses through www.orthodontics.com.